Hello viewers. Today we will discuss about Health and Care Worker Visa. A Health and Care Worker Visa allows medical professionals to come to or stay in the UK to do an eligible job with the NHS, an NHS supplier, or in adult social care. Today, we will discuss eligibility, knowledge of English, healthcare surcharge, what you can and cannot do, salary requirements, money to support yourself, required and related documentation, criminal record certificate, application, how much it costs, and decision. Eligibility. To qualify for a Health and Care Worker Visa, you must be a qualified doctor, nurse, health professional, or adult social care professional. Work in an eligible health or social care job. Work for a UK employer that's been approved by the Home Office. Have a certificate of sponsorship from your employer with information about the role you've been offered in the UK. Be paid a minimum salary. How much depends on the type of work you do. If you're a care worker or senior care worker working in England, your employer must also be registered with the Care Quality Commission. Knowledge of English. You'll usually need to prove your knowledge of the English language when you apply, unless you did this in a previous successful visa application. You must prove you can read, write, speak, and understand English to at least level B1 on the Common European Framework of Reference for Languages (CEFR) scale. You can prove your knowledge of English by passing a secure English language test (SELT) from an approved provider, having a GCSE, A level, Scottish National Qualification Level 4 or 5, Scottish Higher or Advanced Higher in English, gained through study at a UK school that you began when you were under 18. Having a degree-level academic qualification that was taught in English. If you studied abroad, you'll need to apply through ECTIS, formerly UK NARIC, for confirmation that your qualification is equivalent to a UK bachelor's degree, master's degree, or PhD. Healthcare surcharge. You, and your partner or children, will not have to pay the healthcare surcharge. What you can and cannot do. You can work in an eligible job. Take on additional work in certain circumstances. Do voluntary work. Study. Bring your partner and children with you as your dependents, if they're eligible. Travel abroad and return to the UK. Apply to settle permanently in the UK, also known as indefinite leave to remain, if you've lived in the UK for 5 years and meet the other eligibility requirements. You cannot apply for most benefits, public funds, or the state pension. Change jobs or employer unless you update your visa. If your application is successful, you'll get a full list of what you can and cannot do with a Health and Care Worker Visa. Salary requirement. You'll usually need to be paid at least £23,200. If the going rate for your job is higher than £23,200, you'll usually need to be paid at least the going rate. Each occupation code has its own annual going rate. How you find the going rate depends on your job. When you can be paid less. You might still be able to apply for a Health and Care Worker Visa if your job is eligible but your salary is less than £29,000 or your job's lower going rate. You can be paid between 70% and 90% of the lower going rate for your job if your salary is at least £23,200 per year and you meet one of the following criteria. You're under 26, studying or a recent graduate, or in professional training. You have a science, technology, engineering, or maths, STEM, PhD level qualification that's relevant to your job. If you have a relevant PhD level qualification in any other subject, your salary must be at least £26,100. You have a postdoctoral position in a scientific role. Money to support yourself. You must have at least £1,270 in your bank account to show you can support yourself in the UK. You will need to have had the money available for at least 28 days in a row. Day 28 must be within 31 days of applying for this visa. You'll usually need to show proof of this when you apply, unless either you've been in the UK with a valid visa for at least 12 months. Your employer can cover your costs during your first month in the UK. If your employer can support you instead, Your certificate of sponsorship must confirm this. Your employer will need to complete the Sponsor Certifies Maintenance section on your certificate. This is under Additional Data. Required and related documentation. When you apply, you'll need to provide your certificate of sponsorship reference number. Your employer will give you this. Proof of your knowledge of English. A valid passport or other document that shows your identity and nationality. Your job title and annual salary. Your job's occupation code. The name of your employer and their sponsor license number. This will be on your certificate of sponsorship. Depending on your circumstances, you might be asked to provide evidence that you have enough personal savings to support yourself in the UK, for example bank statements, unless your certificate of sponsorship shows your employer can support you. Proof of your relationship with your partner or children, if they're applying with you. Your tuberculosis test results if you're from a listed country. A criminal record certificate, if you're working in certain jobs. Your UK PhD certificate, or your unique ECTIS reference number, formerly unique UK NARIC reference number. If your qualification is from outside the UK, you'll need to apply through ECTIS. Criminal record certificate. You'll need to provide a criminal record certificate if you're applying from outside the UK, unless your job is in one of the following occupation codes. 2113, biochemists and biomedical scientists. 2114, physical scientists. 3111, laboratory technicians. 6132, ambulance staff, excluding paramedics. You might need to provide a certificate from each country you've lived in, depending on your age and how long you stayed in each country. If you're under 28, you'll need a certificate from any country you've stayed in for a total of 12 months or more since you turned 18. Application. Apply online. You must apply online for a health and care worker visa. As part of your application, you'll need to prove your identity. How you do this depends on where you're from and what type of passport you have. You'll either have your fingerprints and photograph taken at a visa application center. This is to get a biometric residence permit. Use the UK Immigration ID Check app to scan your identity document. You'll also create or sign into your UK Visas and Immigration UKVI account. If you do need an appointment, the center may need to keep your passport and documents while they process your application. You may have to travel to get to your nearest visa application center. This could be in another country. How much it costs. When you apply for a health and care worker visa, you'll need to pay the application fee. Support yourself when you arrive in the UK. You'll usually need to have at least £1,270 available, unless you're exempt. You'll be told how much you need to pay when you apply. Application fees. The standard application fee depends on whether you'll be in the UK for up to 3 years. It will cost £284. More than 3 years, it will cost £551. How long it takes to get a decision. Once you've applied online, proved your identity and provided your documents, you'll usually get a decision within 3 weeks. You'll be contacted if your application will take longer, for example because your supporting documents need to be verified. You need to attend an interview of your personal circumstances, for example if you have a criminal conviction. Thank you for watching.